In this video, we will discuss how to deliver a HydraFacial Keravive scalp treatment. For best results, it's recommended that clients have this treatment once a month for 3 consecutive months. The HydraFacial Keravive treatment cleanses and exfoliates the scalp, extracts debris and impurities, stimulates circulation, and nourishes the scalp and hair follicles with the Keravive Peptide Complex solution, a proprietary blend of growth factors and skin proteins that help promote fuller, thicker, and healthier-looking hair. The complete HydraFacial Keravive treatment includes an in-office treatment done using the HydraFacial Elite, Tower, or Allegro devices, as well as a take-home spray that the client uses at home in between in-office treatments. First, discuss the client's areas of concern with their scalp health and hair to determine where to focus the treatment. Step 1 of the in-office treatment uses the HydraFacial Vortex technology, Beta HD Clear solution, and a HydraPeel Blue tip to cleanse and exfoliate the scalp. Step 2 of the in-office treatment stimulates and nourishes the scalp with the HydraFacial Keravive Peptide Complex solution. Upon completion of the in-office treatment, the client takes home a bottle of Keravive Peptide Complex spray to be used once a day in between treatments. Let's review the process and products for each step. Preparation. Advise the client to avoid using styling products before the treatment and to come in with clean, dry hair. Before the client arrives, prepare the treatment room. In addition to Beta HD Clear solution and the HydraPeel Blue tip, the treatment uses 2 9-milliliter vials of the Keravive Peptide Complex solution, the yellow HydraFacial Keravive tip, and a 100-milliliter bottle of the Keravive Peptide Complex spray. Place a single-use HydraPeel Blue tip on the tool holder, as well as the single-use HydraFacial Keravive yellow tip that is unique to the scalp treatment. You will need gloves. A comb with a tail to part the hair and hair clips to hold the hair back may also be useful depending on the thickness of the client's hair. The consultation. Place the client at a comfortable incline with a small rolled towel or pillow beneath their neck. Ask them if they have specific areas of concern with their scalp and hair health. For example, are they experiencing a dry, itchy, irritated scalp? If so, where? Are they concerned about excessive buildup from styling products? If so, where? Do they have specific areas of visibly thinning hair that they are concerned with, such as the crown, a receding hairline at the forehead, or a receding hairline at their temples? For example, men generally experience exposed scalp and thinning hair around the crown, temples, or a receding hairline. Women may experience the same concerns as men, or may be experiencing patchy circles or hair that is thinning evenly overall. Step 1. Cleanse and exfoliate. Position the client looking straight ahead to treat central areas. Have the subject look to the right or left to treat temporal areas. Beta HD Clear solution and a HydraPeel Blue tip is used for the scalp cleansing and exfoliation step. Remove the reusable cleaning cap from the handpiece and replace it with a single-use HydraPeel Blue tip designed for exfoliation. The long end of the tip should be aligned with the top of the handpiece. Use the system touchscreen to start the vacuum. Set vacuum to 25 and set the handpiece serum flow valve to approximately a 20 to 30% serum flow. Adjust vacuum down as necessary for client scalp sensitivity. Before applying, occlude the handpiece, bringing the solution to the tip, and adjust the flow if needed. Part the client's hair with the tail of a comb or your fingers in small sections in order to expose the scalp area. Starting at the hairline and moving back towards the crown, perform short strokes, making contact with the scalp to identified scalp area. Alternatively, you can start at the crown and move forward towards the hairline. Choose the direction that gives you the best contact with and occlusion on the scalp. Stimulate the area until the scalp turns a healthy pink. Choose the next area either to the left or right of the treated area. Part the hair again to expose skin. Remember to work in small sections in order to exfoliate as much of the scalp as possible. Repeat until the entire identified working area is covered. Remember, it is important to target the strokes along the scalp so as not to inadvertently cause damage to hair. When you have exfoliated target areas, turn off toggle for Beta HD Clear solution, discard HydraPeel Blue Tip, and complete a 10 to 15 second system rinse to flush out the handpiece. Step 2. Stimulate and nourish. 2 9-milliliter vials of the HydraFacial Keravive Peptide Complex solution are used in this step of the in-office treatment, along with the yellow HydraFacial Keravive tip. Remove cartridge from the handpiece and insert the first vial of the HydraFacial Keravive Peptide Complex solution into the handpiece. Switch to the HydraFacial Keravive yellow tip and adjust the vacuum setting down to 21. Focus the application of the solution on the problem areas identified in the consultation. Repeat the same pattern followed during the exfoliation process. Part client's hair with the tail of a comb or your fingers in small sections in order to fuse the solution into as much of the scalp as possible. Starting at the hairline and moving back towards the crown, perform a back and forth twisting motion along the length of the exposed scalp, working along the parted hairline in a tight grid pattern. Alternatively, you can start at the crown and move forward towards the hairline. Choose the next area either to the left or right of the treated area. Part the hair again to expose skin. Remember to work in small sections in order to deliver the HydraFacial Keravive Peptide Complex solution to as much of the scalp areas of concern as possible. Repeat until the entire identified working area is covered. Use the second 9-milliliter vial of the HydraFacial Keravive solution to ensure full coverage of the targeted areas and expand to additional sections of the scalp where possible. After completion of the second vial, perform a 5-minute scalp massage to help the HydraFacial Keravive solution penetrate the entire targeted treatment area. Remove the HydraFacial Keravive vial from the handpiece, replace the cartridge into the handpiece, and discard the HydraFacial Keravive yellow tip. Advise client to allow scalp and hair to fully dry before applying heat or styling products. Finish by showing the client their gunky to demonstrate the amount of dirt and debris removed from the scalp. Step 3. Extend and enhance. Following the in-office treatment, present the client with their 30-day take-home HydraFacial Keravive Peptide Complex Spray. Educate the client on how to manually apply the HydraFacial Keravive Peptide Complex Spray at home daily, beginning the day following their in-office treatment. The client should leave with their HydraFacial Keravive spray and an appointment for their next treatment in 30 days. Home use spray instructions. Apply 1 to 2 sprays per area of concern once a day, placing nozzle directly on scalp while spraying. After spraying, massage solution into scalp for 30 to 60 seconds. For best results, apply in the evening and allow solution to remain on the scalp overnight. Thank you for partnering with us at HydraFacial. We look forward to supporting your ongoing success.